Good evening and thank you for joining us. The Thunder Bay District Health Unit is announcing another spike in COVID-19 cases with 29 more in the district today. That brings the total of active cases up to a record 186. Corey Nordstrom spoke to Medical Officer of Health, Dr. Janet DeMille, and has more in this report.
It is uncomfortable to see that many active cases.
Yet again, the Thunder Bay District is seeing a jump in new cases of COVID-19, with 29 more being announced. Breaking it down, 4 are tied to the correctional center outbreak, 8 through close contact, 5 with no known exposure, and 12 exposure sources pending. Just 19 are in the city and surrounding area, 7 in First Nations communities, and 3 in district communities. This brings us to 952 total cases, with 186 of them active. Medical Officer of Health, Dr. Janet DeMille, clarifies the confusion on what constitutes pending cases.
Sometimes where we're still investigating, sometimes we may not have the complete information at the time, and we may indicate that there's no known exposure. And subsequent to that, that gets updated because we might find additional information as we sort of track and trace.
With the number of case jumps recently, DeMille says they have sent off some batches of tests to be analyzed to see if they might be one of the variant strains, with all coming back negative to this point. She chalks up the new protocols being put in place for international travelers as a way to lessen spread of the variants in hopes that they stay out of regions such as ours.
Like, we don't have any identified variants here at the present time. But, you know, we do still have travel. We have people driving through our area every day and, you know, across the roads and transporting goods and things like that. So we are at risk.
Meanwhile, a second outbreak in 2 days is being announced at Hogarth Riverview Manor. Yesterday, it was a 6th floor staff member testing positive, and now it's a staffer in the Birch and Spruce Grove resident home area. As for the ongoing outbreaks at the jail and correctional center, DeMille says officials there don't have to wait until the virus runs its course.
They can be brought under control, but that takes a consistent effort by a number of parties to be able to implement the necessary measures, and that can be really hard to do.
The shortage of vaccines continues to be a concern to DeMille, especially after today's reduction in the Moderna vaccine shipments to Canada. And with Pfizer doses running low at the regional hospital, she says there's still no exact date on when a supply of Moderna doses will arrive at the health unit. Corey Nordstrom, TBT News.
It's a welcome sign for many seniors living in long-term care homes in the Northwestern Health Unit's catchment area as COVID-19 vaccines began going into the arms of residents this week. According to the NWHU, 300 doses of the Moderna vaccine have arrived and have been deployed to several facilities in the Rainy River District, such as the Atikokan Hospital, the Rainy Crest Long-Term Care Home, Emo Health Center, and the Rainy River Health Center. But officials with Riverside Healthcare say they received a limited number of vaccines, not enough to give all residents a dose. At a news conference today, Medical Officer of Health, Dr. Kit Young-Hoon, was asked when and if more vaccines will be arriving in time for that region to meet provincial vaccination target of February 5th. She says she can't answer that, but believes the unit will distribute the vaccine in a timely manner.
So I think a lot of it is subject to supply and when those come in, and that the supply chain is not as stable as we would like it to be. And so sometimes information does change on a day-to-day basis.
Positive tests have started to pop up in some remote First Nation communities, and there's growing concern about whether the government will be able to step in and stop the spread. The Sioux Lookout First Nation Health Authority is now dealing with positive cases in Poplar Hill, Webequie, Pikangikum, and Lac Seul First Nations that seem to be linked to travel.
7 new cases in our communities.
First Nations Health Authority is now dealing with positive cases in Poplar Hill, Webequie, Pikangikum, and Lac Seul First Nation that seem to be linked to travel. Kiiwetinoong MPP Saul Mamakwa is calling on the Ford government to provide faster testing and
there
more
should
on the
be
ground
at
public
least,
health
a
resources
plane ready
in fly-in
pick up those
communities.
results especially like say at a time where there's 30 tests, like if they're doing 30 tests or 40 tests, depending on the contact tracing that's happening, there should be a plane there, not wait for the next scheduled plane.
Mamakwa is urging people in the communities to stay vigilant and adhere to all health and safety restrictions. Ontario's premier is getting ahead of Ottawa's incoming travel restrictions. Doug Ford announced new testing requirements for travelers arriving at Pearson Airport in an effort to stop the spread of foreign variants. Colin DeMello has more on that.
Despite all of the travel restrictions that have already been in place, the new variant of COVID-19 has been slipping through.
Through our voluntary airport testing pilot program, we've already identified 5 variant cases.
Ontario has so far identified 51 cases of the variant, with evidence that it is spreading in the community. And today, the province announced new plans to halt its progress.
This plan will act as a first line of defense against new variants of this virus.
The plan begins at Pearson Airport. Using his powers under the provincial healthcare laws, the Chief Medical Officer of Health is issuing an unprecedented order, making it mandatory for incoming international travelers to take a COVID-19 test.
The ticket, if you refuse to take a test when you come into the GTAA at Pearson, will be $750.
Inside provincial laboratories, technicians will begin screening every single positive COVID-19 swab for the new variant. And the province is also asking anyone who comes in close contact with a confirmed case to now take 2 tests, one immediately and another 10 days later.
And the households of all contacts and symptomatic individuals will be asked to stay home and quarantine until the contact has a negative test.
But in order to gain control of the virus, the province says the current health measures have to remain in place, from the stay-at-home order to the state of emergency and the province-wide lockdown.
We're going to do our best to keep that number down and understand how that's going to affect our public and the admission rates as well as ICU rates, and then we'll have to modify our numbers accordingly.
We've seen it before. Remember when we were down to 100? And everyone thought, yeah, way to go, let's get out there, and all of a sudden, wham, it hit us in the backside, and we'll make sure that doesn't happen again.
Providing very little clarity over exactly when those lockdowns will be relaxed.
Back here locally, the District Health Unit announced last night that 2 people associated with St. Bernard's School have tested positive for COVID-19. The affected cohort was dismissed yesterday afternoon, and all associated parties like parents, guardians, and staff have been contacted by the Catholic School Board. Public health officials are now working to identify anyone considered to be a close contact, and those people will be instructed to stay home until they're cleared. Currently, the situation is not considered to be an outbreak, and there's no evidence of spread within the school. French company Alstom officially completed its takeover of Bombardier's rail division today, triggering a new era for the railcar plant in our city, and the company's CEO says no Canadian factory closures are in their plans. In an article published by the Globe and Mail, Henri Poupard-Lafarge said Alstom does not plan to close the plants in Ontario or Quebec. Dominic Pascalino, president of Unifor Local 1075, which represents hundreds of workers at the local facility, says he's happy to hear it, but he's not pleased with the province or federal government for their lack of financial commitments toward a new contract.
We're happy to hear that. In my mind, always thought that this plant is a very profitable plant. We've been in business for a very long time, and our product and our quality is very good. Really, the action I need right now is from the federal and provincial government. There's no doubt in my mind if we had the new subway cars that they're talking about and the new LRV cars, that would ensure a full plant.
The City of Toronto has already put up its third of the money needed for new subway and streetcar orders, but the province nor Ottawa have yet kicked in their share. A new digital tool is helping keep area surgical patients connected to their healthcare providers from the comfort of their own home. The Regional Health Sciences Centre is the first hospital in the Northwest to offer the new digital engagement tool called Seamless MD.
Seamless MD is your all-in-one platform for patient engagement, remote monitoring, and virtual care.
The app is a way for patients to virtually connect with their healthcare provider. It's already resulted in less congestion in the emergency room. And despite surgeries in December being up by 40% from a year ago, return visits to the ER were down 25%. Caroline Fanti, the Director of Regional Surgical Services, believes the app is just the beginning.
The goal is to focus on giving patients the safest possible experience, feeling connected to their healthcare team while remaining safely at home. And the beauty of the technology is that they're in constant communications with their healthcare team. They're being told what to do on a day-to-day basis.
Helping them to be informed in their own healthcare. They've been thankful that they've had the connection to myself as a nurse practitioner. So I've been able to, kind of flag like, oh, maybe something's not going so well for them at home. They're kind of having this issue or they're struggling with their medications. They just need a little extra counseling. I've been able to call them and just have that discussion with them and kind of reassure them.
Since launching in November, early data suggests the app is popular with patients using it. 91% of those surveyed would recommend it to others, and 87.5% say the program helped them feel less anxious before surgery. A man from BC is walking across Canada carrying a 9-foot-tall handmade cross, and he's now arrived in Thunder Bay. Warren Park started his journey in Kelowna a few days before Christmas. Along with walking, he's also gotten some rides along the way, and he plans to end up in Ottawa in a few weeks. The big cross is on wheels and reads, "Veterans are not asking for more than I can give." But helping veterans is just one of the causes he's supporting. This mission started after he worked on a reserve and became aware of the clean drinking water crisis in First Nations.
I set out in hopes to bring some hope, some faith, and maybe some strength back to Canada, just with, my determination on the causes that I've chose. It's not just veterans and First Nations. I chose mental health, autism, and cancer.
He set up a GoFundMe page. The proceeds will be donated to various organizations that help veterans, cancer patients, and mental health patients, just to name a few. He'll be at Hillcrest Park tomorrow over the lunch hour and the Terry Fox Lookout around 11 a.m. on Sunday. The first official IMAX film is celebrating the 50th anniversary of its release this year. But what many people might not know is that it was shot right here in Thunder Bay and other parts of this region. The 18-minute film, called North of Superior, debuted in 1971 at Ontario Place in Toronto. Jonathan Wilson has more.
North of Superior was seen by 1.1 million people at Ontario Place back in 1971, and those audiences got an amazing first impression of an IMAX film experience thanks to this opening scene shot by a state-of-the-art camera attached to a plane flying over the sleeping giant. It also featured high falls shot from a helicopter and other scenic views of this region. IMAX co-founder Graham Ferguson was the director and cinematographer, and he spoke at a 2017 event celebrating the groundbreaking film.
We needed a theater which would really make it clear, and a film that would make it clear that this was very different from the ordinary movies. And that opening shot was designed specifically to introduce the world to our new invention, IMAX.
The 18-minute film was commissioned by the Ontario government and has now become a quintessential historical document of this region and its main industries 5 decades ago, such as forestry, open-pit mining, and Great Lakes shipping. The film includes footage of the Peninsula Tug, which was demolished late last year. And there are dramatic close-ups of a huge forest fire and the firefighting crews trying to contain it.
Way too hot.
Ferguson was asked to create a travelogue with no narration, just images with music and natural sound. The film includes teenagers tubing at the former Riverview Raceways, kids playing street hockey in a small town, and scenes of downtown Red Lake and a chilly view of downtown Kenora. But perhaps the most touching parts of the film were shot in Big Trout Lake.
And I said to people who lived there, if you were making a film to show the rest of Ontario what your life is like here, what would you film? And they said, film what a good time we have growing up in our reserves. show people that we enjoy our lives there. So that's why Big Trout is filmed the way it was.
North of Superior was still being screened in recent years at Ontario Place and around the world, and the Toronto International Film Festival has recognized it as an essential Canadian film. A high-quality version, along with interviews with its creators, can be found on TIFF's YouTube channel. Jonathan Wilson, TBT News.
Well, tomorrow is the registration deadline for snowmobilers planning to take part in next weekend's Sled for Eternity, a fundraiser hosted by Adult and Teen Challenge. And there's one first-time participant this year who's proving that age is just a number. Meet 77-year-old grandmother Lavina Collins. Her goal is to ride 100 kilometers from Thunder Bay to Kekabeka Falls and back next Friday with her son, all while raising money for the charity. She'll borrow a sled from her grandson to accomplish the feat. The longtime Nipigon resident hasn't ridden in nearly 10 years, but grew up riding sleds and took 2 500-mile tours in her 60s. She's already raised $1,200 toward her $1,400 goal. Collins originally planned to ride from Thunder Bay to Nipigon on a personal trip, but with the pandemic, decided to devote her time to helping others.
I see so many people in need, and I know lots of the people that have been helped through Sled for Eternity, the Adult Teen Challenge, and I thought, you know, I could do it for that. I normally I would be just doing it for a familiarization tour, but I thought maybe I'll do it for charities.
Organizers of Sled for Eternity are hoping to raise $60,000, and even though the registration deadline is tomorrow, participants still have one more week to collect pledges.
Staying on the trails.
Yeah, what a
Love
story.
it. Wish I could join her. Fiona, how's the weather looking? Felt much warmer today.
Well, it was kind of misleading, you know. We had a lot of sunshine today. It certainly started very cold. Wind chills of -33 at 7 a.m. this morning. But we did warm up to not a bad -10. Now, that's only a few degrees warmer than yesterday. The big difference, though, was the wind chill, with winds very light, starting off from the southwest and rotating around to the east-northeast, and blowing only 5 to 10 kilometers per hour. The wind chill just was nowhere near what we have been having this week. So that is definitely a move in the right direction. Now, across the region, wind chills and temperatures continue to be very consistent to the west. We've had a lot of sunshine in Fort Frances at -7, -9 in Kenora and Dryden. In that region, wind chills are around -13. We've got very little sunshine in Red Lake, very gray at this hour at -10. Wind chills there, touch cooler, -17. And as you head further eastward, we've got -11 in Armstrong and Greenstone under clear skies. There, again, the wind chills around -13, -14. And even Sault Ste. Marie, usually one of the warmer locations, is feeling the wind chills in pretty much the same range. They're about -12, -13 at this hour under cloudy skies. Now, here in the city of Thunder Bay, we're only going to drop down to -13. So we're only dropping a handful of degrees. Now, the winds are going to kick up, so the wind chill will feel closer to -22, but considering last night's wind chill, again, moving in the right direction with some light snow showers late in the night, probably closer to the early morning hours, and that is going to set the stage for a little bit of snow moving through the region, but even better yet, some very mild temperatures for those of us needing a break from those frigid wind chills, and I'll have more details later on in the news hour.
A lot of people looking forward to that. Thanks a lot, Fiona. Well, the Prime Minister has been hinting for a while that it's coming, and Ottawa is finally ready to crack down on international travel with some new restrictions. We'll have the details as your Friday News Hour continues.
We will be introducing mandatory PCR testing at the airport for people returning to Canada.